Hi John, how you doing today?
I'm good.
How are you, physical therapist?
I'm good, how are you?
Good. So tell me a little bit about yourself.
20 years old. I like to stay pretty active. I probably lift about 5 to 6 days a week, and I like to wrestle when I can.
That's great. I'd like to see young adults pursue their fitness. Do you have any goals you'd like to accomplish by the end of the year?
I'd like to put on a few more pounds of muscle, but I've keen research on some shoulder rehab to help recover from a recent injury. It often feels stiff and it hurts if I lay on it too long, but it loosens up once I get warm.
Okay. You've done the right thing seeking rehab. Without treatment, there would be a risk of shoulder freezing up, making it much harder to utilize the shoulder's wide range of motion and perform activities of daily living. I'm going to walk you through some rehabilitation exercises that can be performed at home with little or no equipment.
Sounds great.
All right. So, but first off, start with forward flexion. Start with forearm fully extended at the elbow, and while lifting both arms above the head, make sure you're fully extended and bringing them back down slow, and then repeat the process. And what you're looking for is any pain or any abnormalities in your shoulders. Next is an abduction exercise. And you're going to abduct both arms above the head at a 180-degree angle, just like this. And again, looking for any pain or any abnormalities while doing that. This would be better if we were wearing a shirt or wearing a tank top so you could see what's going on in the shoulder. Next is cross-body adduction, and adduct the shoulder by moving the arm horizontally across the chest, and then do the same side, or do the same on the other side, while looking for pain or any weirdness. All right, next is external rotation. Make sure your elbows are at a 90-degree angle, and externally rotate the shoulders by moving them laterally, like this. These movements can and should be performed often. Of course, it is important to give your body a break to refuel and recover, but you lose what you don't use. When you look at exercise as medicine, it is good to utilize your body's capabilities and practice moving in its full range of motion. You mentioned you like to work out often, and I can imagine that this means that the pain in your shoulder doesn't stop you from being active. However, I ask you to perform these movements 3 to 4 times a week, either on an active rest day or to further warm up your shoulder when performing upper body movements.
All right. Thanks for the advice. I'll definitely follow through with these movements. Do you recommend any exercises that would help me add muscle mass to my upper body?
Of course. I often advise my lifters to work on their lateral raises, seated overhead presses, and rear delt flies. I suggest using machines to remove the need for your stabilizing muscles. This allows you to focus on widening your range of motion. many apps that can be used to track your progress. I recommend the free app called FitList. Recording your workouts makes it easier to look back on your reps and sets, previous movements, and gives you a goal to aim for. Alternatively, you can record everything in a notebook. That makes it easier to write a note of how a movement feels and set yourself up for next time by writing an adjustment you want to make.
All right, thank you so much for your help. I'm excited to see what kind of progress I can make during this rehab.